Hi, I'm Dr. Sahar Roked. I'm the GP and the hormone doctor at Omnia Clinic, and I want to talk to you today about hair loss. So hair loss is really upsetting for both men and women when it happens, but a lot of it can be hormonally related, and this is something I see a lot with my patients and something that we work hard to rectify. So I'm going to tell you some of the common causes of hair loss. So when I see a patient, we look at what's going on with the thyroid and do a very thorough test, as this could be affecting hair loss. I also talk a lot about stress, which is really relevant these days as so many of us have had so much stress over the last year or so. What I tend to see is that after an intensive period of stress, hair falls about 3 months later. It's not an immediate thing. So quite often I ask what was going on 3 months ago, and that correlates to the hair fall now. I've certainly had this in my own personal experience too. There are, of course, things we can do about this. If the thyroid is irregular, there are supplements and medication that we can add in. And if the cortisol stress levels are high, similarly, there are supplements such as B vitamins, magnesium, herbal supplements like ashwagandha, rhodiola, phosphodiesterine and ginseng that can all be of benefit. And of course, let's not forget the most important thing, lifestyle changes. So if stress is the issue, we have to address what's going on in terms of lifestyle as well. And it doesn't mean you've got to change your whole life and your whole routine, but it is looking about building in little things every day to have some mindfulness, being breathing exercises or doing some yoga or journaling or keeping a gratitude diary or having a little bit of time to do some self-care for yourself. All these things are really important. But back to some more of the other hormonal causes. So for women, low testosterone can actually cause hair loss. So can high testosterone, of course, but this is less common in women. But low and high testosterone can cause hair loss, not just in women actually, it's in men and women. So this is something that I like to check with my patients. Also, for women in particular, if progesterone levels are very low, then you can get hair loss or not have the hair regrow. So when a woman's pregnant, she has tons of progesterone. You need that to support the pregnancy. We don't need as much if we're not pregnant. But what do most pregnant women have? Beautiful glowy skin and beautiful hair. Makes sense, right? You don't need as much as a pregnant woman, but a little bit can make a big difference to your hair. So when I see people for hair loss, we look at all these factors, including lifestyle, diet, nutrition. We also look at these supplements, some of the ones that I've mentioned already and also some others. There are things that I can prescribe in terms of supplements for the hair, balancing the hormones, and also topical hair tonics that have some medication in them and also some hormones. And I see amazing results with that actually. So I just wanted to give you some indications of things that we can do with hair loss and for you to feel like, I know it's quite an emotive subject, you know, the way we look, our hair, the way we feel about ourselves. So if this is something you're going through, I wanted you to know there's definitely answers out there and help at hand. And if you need me, give me a call for a consultation and I'd be more than happy to help you on this journey.